I am delighted to introduce Gaurvika Nayyar. Ms. Nayyar is co-editor of this special malaria supplement of the American Journal of Tropical Medicine and Hygiene, again titled The Global Pandemic of Falsified Medicines, Laboratory and Field Innovations and Policy Perspectives. Ms. Nayyar serves as a program manager at the United States Pharmacopeial Convention, also known as USP. Previously, she worked as a business analyst intern for vaccine delivery and polio eradication at the Bill and Melinda Gates Foundation. Ms. Nayyar has held positions as a research fellow and research associate at the National Institutes of Health. Ms. Nayyar received recently her double master's, an MPH, and an MBA from the Johns Hopkins University. Welcome, Gaurvika.
Thank you so much, Jim. It's really exciting to be here with all of you in person, but also all the people chiming in to listen about this important problem and a very serious public health threat to a lot of the programs that we're running abroad, not only in developing countries, but also a relevant threat for developed settings as well. So as Jim already mentioned, I've been working on the supplement with Joel and Jim, and this has really evolved over a period of time when we started thinking about drug resistance, but has now grown into sort of shed light on the larger problem of poor quality medicines, not only for anti-malarials, but going beyond that to leishmaniasis medicines, to lifestyle drugs like diabetes medicines. So while anti-malarial medicines are an indicator of the problem, since they're the most heavily studied, we do know that this is actually a much bigger issue. So as the data presented by Dr. Joel Bremen, we know that this is an epidemic occurring over a very wide area, crossing international boundaries, and now affecting an extremely large number of people. And even though some would say that the increase in reporting might be just due to increased concern about the problem, the truth is that this is just really the tip of the iceberg. We're seeing a lot of cases that are reported to the wrong agencies or not reported at all, because the patients are often not alive to tell you that they received poor quality meds. So we brought together a lot of policy experts, lawyers, epidemiologists, public health professionals to think about what were the biggest obstacles in addressing this problem in a coordinated way like we would any other pandemic. The problems we found were fourfold. One is that there's a lack of consensus on definitions. Technology around the problem is there isn't really a clear understanding of which ones are reliable, which ones can be relevant for scale-up. And as we know that at the heart of solving any epidemic or pandemic or really addressing the problem, at the heart of that is a diagnostic that will help us on the field. And similarly, we need technologies that will detect these problems on the field. Leadership and accountability. Who is truly responsible for this problem? Are countries taking ownership? Is there an international agency that's coordinating a response? Do we have a global strategic plan to address poor quality medicines? No, that's not available right now, and it's urgently needed. Last but not the least, deficient regulatory and manufacturing systems around the world are a problem. But because the biggest manufacturing of most of the medicines are coming globally from India and China, and due to the large manufacturing bases there, it's important to note that we do need to have a targeted response in those countries. So why is the pandemic, if this pandemic goes unchecked, this could be really devastating for all the progress that's been made against malaria, against HIV, against TB in a lot of these developing countries, but also around how this will now spread to other countries that maybe previously didn't have the problem. So morbidity and mortality isn't the biggest concern. There's also the issue of drug resistance that our colleague Dr. Dean Bluin also mentioned about. That drug resistance is going to sort of magnify the impact of poor quality medicines around the world, and we do need a response. So we brought together these experts and said, well, what would be the highest impact areas for a response to this problem? We came up with 4 areas of response. First was building a research and technology agenda, specifically with investments to compare and scale the best technologies for detection. This would be relevant not only sort of at the beginning of the supply chain, but all across, down to really empowering the consumers and the pharmacists on the field who are actually dealing with this problem. Also conducting surveillance and actively tracking this with the robust epidemiological methods, which Harprakash and other authors also mentioned. Last, we would like to have an active global leadership organization, like Dr. Bremen mentioned, and also create national policies and an international convention, so a top-down and bottom-up approach, providing both a legal and institutional framework for regulatory action around the world. That's all the time I have now, but if there's any questions, we will be addressing them at the end. Thank you so much.